It's like my body won't never
No,
do it.
did you feel that?
Yeah.
Shocked me. either she's gonna nail me now,
No, it didn't.
and you just moved the rods out of my back. I don't know. Our world demonizes scoliosis, and I'm not 100% on board with, I have too many people with straight spines with terrible back problems to be able to just say.
And I wish, because I was young, I didn't know, because I found out, when you go to school and they check you, and I wish I would have known what I know now.
Sure. We demonize scoliosis because it doesn't, we've said that this straight spine is normal.
Right.
And the reason why it happens is as you're growing, the distance between your skull and your tailbone is increasing. And it usually happens, like you said, at 13 when they did the surgery. As you're growing, the bones can grow faster than your spinal cord can grow. So your spinal cord is attached to your brain, and then it ties down to your tailbone, your coccyx. And so as you're growing, do you see how this distance is increasing?
Right.
So the bones can grow faster than the spinal cord, which is inside of what we call the spinal canal. Mm-hmm. And so what the compensation is that the spine buckles laterally to relieve pressure off that cord.
Okay.
And they found that essentially that the brain, when they took people and they tried to straighten their spines, sometimes the brain can actually get pulled down into the neck because, does that make sense? Yeah. It's like driving down a road. You ever see somebody like cut the corner? Like instead of it taking that winding path, you cut the corner to, and that's what the buckling is being done to relieve pressure off your spinal cord. We're supposed to have these front to back curves. Let me grab a model. It's just tough because the mobility of your spine is what keeps it clean. Right. So if they put a rod in there, the self-cleaning not only just to the joints in your spine, but your lungs, it's going to be hard to. The mobility is what sort of washes the tissue. So we're supposed to have these front to back curves. There's supposed to be an arch in your lower back called a lumbar lordosis.
Okay.
There's supposed to be an arch in your neck called a cervical lordosis. We develop this curve at around 3 months old. We get an arch in our neck when we're a baby, when we're learning how to hold our head. It's not because the babies have poor strength. It's because they're all bobble-headed when they're young because they're actually learning how to get their head over their shoulders. And then when you crawl, when you're a child, you develop your lumbar curve. So this arch is supposed to take us throughout life. Every 5 to 10 year old has the right alignment for the most part. And then we start losing it because of the predominance of phones and rounding forward. So as you when you sit normally, your curve in your lower back goes straight. That curve reduction can either go into a hump in the upper back, which is what sometimes you'll see is people developing the hump in their upper back, or what we call a thoracic hyperkyphosis. But what it can also do is that it can buckle laterally. Right. So instead of developing the hyperkyphotic curve, it buckles laterally because curve has to go somewhere. Right. That makes sense. You have to have a certain amount of curve in a certain dimension. It either has to be going forward and back, or if you lose that, it has to go up here, or it has to go laterally.
Ultimately, it has the spine to have.
There has to be a curve. Laterality of the spine. So mine's about a 19-degree curve. So it always goes to the right in the chest because the heart's over here to the left. Mm-hmm. So it buckles to the right, and then it buckles left. And then on that right side, is that what you're saying? You're feeling some symptoms?
Correct.
So that's where I feel mine too. It's that the right side, the ribs are all expanded. There's a lot of swelling on the right side. So this is more of a typical, common area that you'll have pain when you have a scoliosis. And do they have it pretty straight? Does it look?
No, you can tell.
It's still lateral.
Yes.
So I almost that's amazing that they can you can put a fusion in there and it still isn't straight.
Right. And it's mostly, and I don't know if it's because of the rod, but I get a sharp, like sometimes I can just be sitting like this and I get a sharp like pain, and quick as it comes, the quick as it goes. It's like it feels like it's itchy but painful at the same time. I'm not sure where that comes from.
You're able to pinpoint the exact spot.
Yeah, it's like between my shoulder blades and like kind of down here.
How about in here around?
Yeah, right in that area.
So there's a couple things we'll show you. Let me have you come over here. So the lower neck joints will actually refer pain to the border of the scapula. Okay. And there's two things that there's a lot of overlap there. You have the local joints that attach to the rib heads those will give you a sharp pain. If you inflame a joint in here, it can be, because of the rod and because, like I said, that self-cleaning isn't functioning, you can have, sharp pain just from the joint, and then you can go, Ed, it's right there.
Yeah,
it also
that's
can
where
be,
it is, like.
you also can be from, because this is stiff, your lower neck doesn't have a rod, and so this area is adjusting and compensating for this area not helping and assisting. You follow me? Okay. So this part can be overstressed, and when you overstress the lower neck, you get pain referral right over that area also.
Makes sense.
And then look straight forward. So your head's about 2 inches forward from your shoulder. So your shoulder is right about here, and your ear is about 1.5 inches, about 2 inches forward from your shoulder. So you have almost 3 overlap things that could be. It could be the joint in the back, not clean, and that's a tough one because the mobility of that area, I'm going to see how much I can get moving, but the mobility of that area is what keeps it clean. If it's just the lower neck, that'll be a thing that you can easily fix that. We get ice on that, stop putting heat on that, stop looking down as much as possible. That'll take the stress off that. Get the upper neck working, and then I can help you get your ear back. That's what I do for my bread and butter is to help change the ear to shoulder alignment, forward head posture, and then get this arch back in the spine. I have a 19-degree lateral scoliosis, and well, Ed, you're a chiro kid. How do you have a scoliosis? See, I would be 6 foot. I'm 6'2", but I'm 6'4" if you pulled my spine straight.
Wow.
But my bones would be 6'4" if you pulled it straight. But my spinal cord is only 6'2".
Okay.
Does that make sense? So I only can be as tall as the nervous system is housed inside there. So if you pull my bones straight, the actual spinal cord becomes tethered, and I get like constant headaches. So this, I don't know, it's a tough one because I only can be as tall as that makes sense, what's contained inside of
it, right.
of there.
That's the
See,
same
the mobility is what I'm trying to say, is what washes the tissue, and it's just going to be a tough one, and I'm sorry, it's just, we're going to have to try to manually clean it, and I can get it feeling better, but it's just, and it's back again, that's going to be a thing that you'll be fine. I think we can get rid of all these, a majority of these symptoms, but the ability to change permanently the position of all these bones because there's rod in your back is going to be tough. A lot of what I do for patients is to take the stress off your lower back, I get the middle back working.
Okay.
You having this area fused makes your lower back, again, just like your lower neck does too much, your lower back is going to do too much.
Right.
And it's just about any vertebrae that's still not fused, I need as much functionality. So there's 24 vertebrae. Ed, they fused 12 of them. So now I only have 12 vertebrae to chew. I only have 12 teeth to chew on. I don't have 24 teeth to chew on anymore. So I need, now of those 12 vertebrae, I have to have every one of them working. I can't lose 7 of them and just work on 5.
Right.
Follow me? If you're just running on 5 vertebrae out of a team of 12, it's going to be a tough road. And so the goal to me your rest of your life is to keep, and I'll try to see if I can teach you how to talk to each part of your spine that's still not fused and get it moving as best we can to spread out the stress. Gravity is stressful to your spine. If we could all float in 0G, but we're under gravity, and so we need to have the weight spread out over as many segments as possible. I'm partly curious. I'm going to go real gentle. I don't expect there to be too much clicking in here. I'm just going to see how much suppleness is in the middle back.
Okay.
All right. Bend both the knees for me. We're going to cross your arms. There we go. You're going to bring a little sit up for me. I got you. Breathe in deep for me. I got you. Real gentle. Exhale. I got you. Keep exhaling. Keep exhaling. Good. Breathe in deep for me. I got you. Exhale. I got you. There we go. Okay. Breathe in deep for me. I got you. Exhale. Yeah. It's okay. It's okay. All right. Stay there for me. Perfect. And that'll sort of keep you from spinning.
Okay.
And if there's any pain while I'm rotating you, just let me know, okay? Breathe in deep for me. And then exhale. Here we go. Exhale, exhale. All right, other side for me. It's okay. We're going to go easy. Breathe in deep for me. Exhale. All right, so face up for me. Face up. Okay. All right. Where things are here. Sometimes a lot of the vertebrae need coercion. I know you just drove a lot, and I use coercion, I call it massage, to help get the joints softer so that I can adjust them. I'm not going to He-Man adjust you. You understand? I'm not going to, try to push as hard as I can and body drop you, WWE, see if I can pop a bone. That's not my goal, because I'm not trying to move every bone in your spine. I'm trying to move certain ones. Does that make sense?
Yes.
I know your lower back's not fused, but I have no interest in adjusting L5. I have no interest in adjusting L4. Very presumably, you're 35 and your lower back is older than you are, so I see no benefit in further adjusting hypermobile areas. I'm trying to check the SI joint, which is not an area that ever has surgery, and the more motion we have on your SI joint, the less pressure your lower back has to take. The main message that I have for scoliosis patients is to keep it all working. I won't demonize it, because I have too many people with straight spines with terrible disc herniations, and I have people with scoliosis spines who have no disc herniations. Remember how I said you're supposed to have these front to back curvatures?
Right.
The scoliosis is a lateral curvature. So it's another dimension of shock absorption. We have curves for, does that make sense, to spread the work out, and
Right.
I won't accept this idea that it's something that needs to be fixed or removed. To me, we have less disc herniations in scoliotic patients. Now, what we have with scoliosis is asymmetrical joint utilization. So one side of your back is being used more than the other. All right, I'm going to go real gentle. I got you. Real gentle. It's okay. I got you. There we go. Okay. There we go. Turn your head right. I got you. Just this top guy. Real easy. There you go. Very good. Very good. Yeah, it's a favoritism to tilt your head left, and you'll see it, and I like to tilt my head left more than I tilt my head to the right. So to stave off the accelerated aging on the left lower part of your neck, I need this part. I need your neck to be able to come over here a little bit, and then sort of the stretching that I'm going to show you is going to be, we're going to have you back on the Denneroll. There's a thing called a Denneroll, which is a retainer. It's a molding device that's sort of made out of my thumb, and it holds you in this curved position. And so we're going to be in this curved position and then over to the right a little bit. Does that make sense? To hold you. We call it mirror image. So we take you to the opposite of what where you want to be. Right, where you want to be. And again, I don't really win. It's like, this feels delightful. My body's used to bending forward, and you're bending me back. There you go.
I thought that was just my shoulder being real tight.
Right. It's guarding, protection. When you have a trauma like that, I call the surgery a trauma. It's a trauma. And your body's reflexive reaction to that trauma is to stiffen up, you understand? And kind of a protective position we do when we get, like, say, in a car accident or a fall, we raise our shoulders, right? It's a guarded position, and your body, as a result of these traumas, is in guard mode. And part of it now is part of that guarding is stiffening down the 12 vertebrae that are still functioning, right? And so I can't allow nobody's allowed to take any more days off. Right. I need everybody working, everybody complying. There we go. Yeah, there's really not much to see over there. And I call this, you're my neck, this is my spine. When I'm working on you, I'm like, this must be how my spine feels to my father, because I know my atlas is over to the right, because I favor tilting my head left, and so I try to.
I didn't realize I had a knot right there.
Yeah, it's because the head's right. It's because you have this favoritism, and you gotta go deep. If you want this change, we gotta hold you pretty deep to the right, and then it takes about 20 minutes to stretch the ligaments. Actually, the ligament on the left that has to be stretched open. Does that make sense? This left side has never been stretched because your neck likes to tilt left. So the purpose of what I'm trying to do now is to get the joint to compress enough on the right so I actually can stretch the left side. Yeah, it's the left side that has to be stretched open to permanently change this. Go real gentle. Here we go. We'll go a little deeper on this side. I got you. I got you. Let me have it. There you go. You okay? Yeah, that was good. Much deeper now. You're actually able to tilt much farther to the right. So getting that atlas shifted to the left. So you need some deep adjustments, almost focused deeper on the right. The left side doesn't need to be worked on. It's already moving. I would almost try to do the first 5 visits almost just right side of your neck, just to get the right side to catch up a little bit before. See, the left side will loosen up really quickly because it's already loose. The right side's going to lag behind, and if you work on both sides evenly, sometimes the disparity doesn't change. You follow me? The left side gets really, really loose, and the right side's just getting a little bit looser, and so the contrast either stays the same or actually can get larger, and so even though you're being adjusted, you're not balancing the spine.
I feel it.
Right there, yeah. There's a knot right there, and that's because it gets larger as your head tilts to the left. This side expands open, and so where your wear out is that left lower. You know, if you're feeling it on the right, I'd almost say it's because this is sort of a newer pain because you're in avoidance, and then the left side will be the compensatory pain. This will be the pain when you're avoiding, when you're over to the left so long, then this side will catch up. But right now I'm just going to start just keeping all this clean. There you go. You're doing great. You're doing great. There we go. I'm going to work this rib down here a little bit.
And I didn't realize like your ribs come up that far.
Yeah, first rib's a little circular rib. It's right there. Yeah. It's right there.
I've been noticing this side. I thought it was my neck. Neck pain. Just I was like, it's been really sore the last couple of days.
Yeah. It's the joints are loaded with pain fibers. That's going to be the local pain in your spine is the knuckles.
Okay.
And then when you're getting it into the shoulder blade or in that area I showed you on that poster out there, that's when you're getting the referral pain. Embryonically, this area of your neck and the shoulder blade both had a common ancestor kind of idea. The embryonic spinal cord is called a notochord. It was a line of cells that were dividing that created you, and so this area and the shoulder blade are common ancestors, and so when this hurts, there's going to be a pain. Okay. Neurologically, there's an overlap. See, the way the nerves work is through electricity, and electricity goes through cables, and if you're having electricity go down one cable and there's another cable that's close by, some of that electricity can...
And that's what it feels like it's within my nerve.
Right. The nerves, there can be a jumping of the signal between areas. So if this hurts here, you can get an electrical activity down here from nerve overlap. It has to do, and then some people have more insulation around nerves. So some people can have inflammation here and not have that because they actually found some people's spinal cords, the nerves are more insulated. The actual spinal cord, the position of the tracks in the spinal cord are not like set in stone. There's some variety. It's not like when they were teaching us neuroanatomy and spinal cord anatomy, it's like this is roughly where they are. It's not cerebrospinal tracts here, your spinal thalamics here, your corticospinal. They're all in general positions, but there's a little bit of variety, and so some people don't have the same types of pains. It can be kind of like the cards that you were dealt a little bit at birth, and as the genetic mix-up happens when you're being made, this is directly tied with that more so than other people's. And lateral.
Do you see children? Because my son, he just turned, because we actually share the same birthday, so he just turned 12, and I'm like, I hope he,
I always adjust. I check for it heavily when the kids are becoming 12, right before the growth spurt. Okay. Most scoliosis is developed during the growth spurt when, again, the bones can grow fast. Like a bone can grow a centimeter a month, let's say, right? You're growing, it's a spurt, you understand? But the spinal cord can only grow half a centimeter a month. Okay. Well, what happens when the spinal cord is tied to your tailbone? So the bones are spacing out faster than the nervous system can grow. So the spinal column diverts laterally to relieve pressure off the spinal cord. When a kid gets to that area, I almost adjust them as if they have a scoliosis, even if they don't. I just the scoliosis always goes right, left, like I said, because the heart's over here. So you almost always have we call it a dextro-levo curve is what it's called medically, but we never see a levo-dextro. We always see a right-left. Okay. And that's, again, so I'm almost preventatively always sort of pushing. The other way. If I see it start buckling that way, I want it to try to grow as straight as possible. And I call it the baseline. Everybody's scoliosis has a baseline, and then we can feed it. So, for instance, I like to stand like this. Mm-hmm. It feels good to, that makes sense? Now, I constantly sort of tell myself,
but it's not comfortable to the body.
It's not comfortable, right? So, now, like you'll see it even on my shoes or my flip-flops, or, you'll see the right heel is where I like to stand. So I'm almost constantly conscious of put more weight on my left leg, right? Try, because I know I have a favoritism to do this, so as much as I can, I try to undo that and not, I call it feeding the monster. If I fed it, I might be able to get my 19-degree curve to 40, and then it gets worse. Does that make sense?
Yeah.
And then I'd have to try to bring it back down to baseline, bring it back down to 19 degrees would be the goal. I believe almost all scoliosis has a baseline. Mm-hmm. Now, what is the baseline? I don't know until I start stretching you.
Right.
Some people might be 5 degrees, some people might be 30. The minimal amount of curve laterality that has to be there to not inflame the spinal cord that's housed inside. Okay. All right, let your chin go down a little bit for me. I'm just almost done here.
It's warm.
Yeah.
I guess that's the blood
circulating. We're trying to wash. So remember, the blood is what brings nutrients in, and like I said, we're trying to help speed up this replacement rate. Here's T1. Your scar runs from about T3 down to, one second, I guess L1, L2. It's spanning about 11 vertebrae or so. Mm-hmm. Try to be like a velociraptor. Okay. Go to the edge of the fence, and when I get zapped, then I pull back a little bit, and so you sort of have to let me know when I touch the fence. Hey, Ed, back off.
And I'm learning, by taking care of myself, it's not okay to be in pain,
oh gosh, yeah, you gotta.
Because you get so used to it, you be like, this is just the way I'm supposed to be.
Oh my, no, it's like filthy. I remember I didn't change my windshield wipers on my car one time. My dad gets in my car, I think I was like 16 or 17, and he's like, Ed, you need to do windshield wipers. And I just gotten so used to, having wipers that didn't do a good job of getting the water off my windshield.
Right.
And my dad was appalled, and he's saying, Ed, you got to get new blades. I can barely see out the window. And I was like, no, I can see right here, this little crack right here.
Right.
Isn't it just normal that it's all blurry when it rains? And I put new windshield wiper blades on, and I was like, oh, yeah. I can see clearly now, the rain is gone. Anyway, so it's tough. It's tough. So yes, the mobility is supposed to be here. There we go. This is that first rib right there, that little crunch. Yeah. I usually name them after old boyfriends. That's Johnny lives right there, whatever. It's it's like, oh no, my dad's car's got door dents, my car's got door dents, my mom's car's got door dents. Just normal. All my cars in my family have door. No, I won't accept that. I won't accept that it's just normal for there to be inflammation and crunchiness in here. This is a result from your head being forward.
Right.
Not having Dr. Bo, my father, is your father, who was constantly on me as a teenager and as a young person. If we lifted something, it was like, it wasn't worth doing if we couldn't do it safely, right? You're saying my dad wouldn't let us do it. So you're like, nope, sorry. We got to make sure we have a back brace on. It was like we highly valued our spines.
But you're supposed, but we're not taught that at all.
Right, like football and hockey, we're like, nope, my dad, nope. Dad, I really want to play football. Nope.
Because he knows what that does to your body.
If you're going to be a pro, maybe. If you're going to make millions of dollars, okay, fair enough. It just, to me, this all has to be manually. Down here, it's like, feel how soft it is down there? It's real. Yes. Your lower back's real limber. And
I do feel that.
The game that you're going to have to be aware of is that the lower back is going to have, it's about taking as much burden off your lower back as possible. When you're lifting, you should have a back brace on your lower back. And Ed, I can barely bend over because if my middle back doesn't want to move, my upper back doesn't want to move, and you put a brace on my lower back, I can't. But I almost want to, protect L5 and L4 because those guys are going to be your frontline workers. All right, there we go. Yeah, right there. Yeah, you just got to get in there. I know. Oh boy. You okay?
Yeah, that's good. That's good. I have a high tolerance of pain.
How many kids? You have 2 kids?
Yes.
So there's your, exactly. all the toughest patients in my office are women, especially if they've had children. They become
You have to be.
right. Men are almost always the ouchie.
That's not a tickle. I don't know why.
All right. It'll get replaced with
Pain.
That's just me not going deep enough yet. There you go. Yeah. All right, breathe. Mm-hmm. All right there. Yep. Mm. All right. All right. Mm-hmm. There we go.
I don't realize how many knots and stuff you have in your back.
See, the sensors are based on mobility, and that's going to be, I mean, this is you're my perfect example, is that because the joints don't move, I don't know how you could feel this, right? Because if the sensors are based on mobility and the area's been fused, it's just going to be tough to have a conversation with these areas. And,
No, for this, I'll come back if it's 2 weeks.
No, it's just, you should be able to find somebody that can just, you're looking, sometimes it's just like a deep tissue workplace, and you just ask different places and, I'm looking for some soft tissue care at a deeper level. I had a guy who actually was up in New York City and he saw a sign that said gua sha, $50, and he was like, oh, Dr. Ed does that, I'll go here and do it. And he walked in. Now this place was like an authentic,
Right.
It wasn't an Irish boy doing it. It was, and he goes in and I think he had pulled something playing basketball and they sort of really aggressively gua sha'd him. And he said, Ed, I got beat up, man. Your gua sha is so much more gentle than their gua sha. And I'm like, well, I try to make it a little bit kinder. But the way they teach this is to be pretty deep. You're trying to, get to the bottom layers and pull all the toxins, all the acidity out of the areas that have been mechanically either protected or posturally contracted, to desensitize and clean the spine. All right. You're doing great. First time you've been combed.
Yeah. It's not as bad as it looks. It's really not.
Do you feel any itchiness?
No.
Okay. Sometimes the detoxing effect, you can get like itchy.
Right.
Almost, like,
I just feel warm though.
yeah. That's very cool.
That's actually why a mosquito bite itches, is that the mosquito actually puts some of his saliva in your body,
Okay.
which is a toxin, right? It's like, what is mosquito saliva to your body? It doesn't belong there. That's why I call it a toxin, right? It's not a nutrient, it's not a vitamin, right? And so your body's saying it itches is almost like a way of getting you to stimulate the area, to draw blood to the area, to wash out the toxin that's in the tissue, right? So that the same sensors that are in the skin here, as you're drawing the lactic acid out, sometimes it'll itch because you're activating those same sensors that the mosquito bite activates.
Okay.
Anyway. Just gonna,
How long was your recovery from do you remember when you were 13?
I think
Few months?
maybe I don't like hospital, so I'll be ready to go.
Yeah.
So
Yeah.
I think I was in there maybe a week,
Okay.
Wow.
but I was out of school for 2 months though.
Okay.
Yeah, 2 months out of school, that makes sense, yeah. This is not like, gosh. there. That's the joint.
Yeah.
Same thing. We're gonna do this again. Head back. Okay, I got you. Let it go. A little bit right there. Yep.
It's like my body won't never do
No,
it.
did you feel that?
Yeah.
Shocked me. either she's gonna nail me now,
No, it
and
didn't.
you just moved the rods out of my back.
No, it felt. It didn't.
No.
It was no
Those
pain.
bones haven't moved, and
It needed. It needs that though.
you did great. We got them moving.
Okay.
Your face, I'm like, what's that? It's like
I'm gonna have you go slide down. We're gonna on your side. We're going one more time. Exhale. Exhale. There we go. A little piece.
A little bit.
I'm amazed that your upper back moved. That was great. That was, that's great. Just getting as many.
I usually hate this. No, you're because my boyfriend usually and it just like why are you pulling my toes?
Poor technique. All right,
Yeah,
go-
he
go
doesn't
ahead.
know what he's doing. It's like I hate it, but when you
So
did,
don't try this at home.
I didn't even notice. I'm like, oh, he's pulling my toes.
Go ahead and grab the table from the top. Sort of hold yourself exactly right there. I got you. There we go. Let the leg go. There we go.
See, I can't
Good.
relax.
You did good.
at
You did.
all.
It's good. It's good. It's okay. The trick is you have to grab the base. If you're grabbing too close to the end, it's going to really hurt people. You got to grab deeper. Okay. You gave away the trick. The first.
It's so irritating when he does it.
Like when they're first teaching you how to adjust, the first mistake that you make as a chiropractor is you just punch people. In chiropractic college, like, we are not punching people. This is a adjustment. There we go. And there's a preload. See how there's a preload and then a little.
Yeah.
You're saying, so generally you just start yanking and.
Yeah.
Don't give away your secrets, Ed. Yeah. All right, I got you. I got your leg. There we go. Good.
I have big ears too.
You're
so
fine. You're fine.
It's easier to
Go ahead,
grab.
go ahead and tilt your head left a little bit for me. All right, actually, I need grip. I can't get any grip. I got you. Tilt your head left for me a little bit. There we go. Good.
Oh, I heard it.
Yeah, I think I heard
It's like
it too.
water or something coming out of your ear.
Let me get the top part here.
It's not as bad as people make it seem.
Tilt your head left. There we go. Good.
Yeah.
Yeah. You're good.
It's like you have water in your ear and you know how you kind of, that's a
Like
little
piece of
sound.
cake.
Yeah.
She's had 2 children. I've had 2 kids. All right. I got you. Good grip. All right, go ahead and tilt your head to the right a little bit. Yeah, good. All right, tilt your head to the right.
You can crack like literally every
Good.
part of your body.
Put your hand on your hip. I haven't done your hands yet. All right, so sort of press back with your elbow. You're gonna press back. There you go.
That way, okay.
Keep pressing back. Keep pressing back. Keep pressing back. There we go. Good. It's okay.
My elbows usually
I'll check it.
always crack
Hand around
or
your hip.
something.
Sort of press your hand, elbow back into here. There, good. Yep. They made a piece of foam out of my thumb, and it's a retainer to help hold that curve in your neck. And this is what I meant earlier. You'd have your head back over it, and then just a little bit. If your head back, good, and then just a little bit to the right. Get the idea?
Yeah.
To help mold, and then you would stay on this for about 20 minutes.
Okay.
Why 20 minutes? Is this a made-up number? No, it's about 20 minutes it takes to change the posture of your neck. And so, if you did a time-lapse video of you on this, you would see your neck over 20 minutes stretching into this curve.
Okay.
You follow me? And so it's just loosening up the spine and then trying to get as much of this arch back in your spine. And that's, to me, what really causes the scoliosis is you lost this neck curve, you lost your lumbar curve, coupled with the fact of a growth spurt, and then the spine deviated laterally. Because some people will it'll just deviate front to back,
Mhm.
right? The people just get a hunch in their upper back. So this is where I would just stretch like this for a little bit, let your head sink in, close your eyes, take a little nap,
Mhm.
and just let that stretch.